Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts, powered by Encore Research Group, and hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, I'm Dr. Michael Koren, and I'm really excited about this session that I just had with Dr. Trey Wilson, who's sitting beside me here. Dr. Trey Wilson is a dentist who practiced for 37 years in New York City and got very interested in horticultural therapy. And he's been educating me and hopefully our listenership to what it means to do horticultural therapy and how it helps people. So let's continue our conversation because I learned a lot about the intrinsic value of getting your hands into the dirt and how it affects people and some of the positive experiences that you've been able to help people achieve. So I want to get into a little bit more detail now with you.
Sure.
So we talked a little bit about that there's different elements of getting back to nature, getting back to gardening. So explain to us a little bit better about trees versus plants versus all the different ways we can access nature and which niches may be fulfilled when you look at healthcare and wellness.
So I think it really depends on the comfort level of the client. I have a client, I'm also a landscape designer, who is terrified of plants. And she is really afraid of the animals and rashes and all types of things that she thinks in her mind plants are going to create for herself.
Wow.
But so we started with her taking care of a houseplant indoors. That was her horticultural therapy experience. But for other people, then the forest is available. And so all of this works because of what Edmund O. Wilson, the famous Harvard anthropologist, says. We all have this biophilic response. Biophilic, love of nature. What is it about when we're in the presence of nature that happens for us? Why do we sigh at sunsets? Why when we look at a mountaintop, our heart rate goes down, our mind stops racing? What's actually happening here? And so forest therapy is derivative of the Japanese practice of forest bathing, which began in the 1980s when the Japanese medical community noticed a change in the levels of obesity, depression, heart disease as the Japanese workforce moved from an outdoor environment to an indoor one. And so in Japan, for instance, covered by insurance, a doctor can write a prescription for 10 forest therapy sessions.
Interesting.
So that patient, obviously you have to be comfortable being with the great outdoors. So wherever you are, if it's caring for a house plant, if it's planting seeds with your grandchildren and watching the delight that your grandchild sees in growing something from seed, nature has a solution because that's how we're designed.
Interesting. Fascinating. So tell me a little bit about your cognitive process when you're analyzing a specific situation. So for example, I know you've been hired by major medical centers, by nursing homes, other healthcare organizations, and they have a sense that getting their customers, their clients, their patients closer to nature may be of some value. So walk me through that process a little bit, how you would analyze that.
So it'd be, who are the clients? Are the clients physicians, clinicians themselves? Is it caregivers and the patients? So, and just ultimately deciding what the goals are. So for one of the hospitals that I did work, it was a therapeutic garden for clinicians struggling with COVID burnout. And so we wanted to increase socialization. We wanted to give them a place where they could just get out from underneath paperwork and be still, just to be still. So we created these meandering pathways through a natural habitat of plants and provided the opportunity, invitational of course, to engage in a very specific way. So it might be, for instance, having a stream of running water where you could sit in a little enclave, a stream of running water going by, and there would be different sized rocks. And the activity was notice what happens to the sound of water when you impede it in different ways. It's just very, very simple things, but it gets people, again, out of the prefrontal cortex into the place where we experience things like awe and wonder.
Right.
So kind of just knowing who your patient base is. If it's people who are acute trauma patients, I'm gonna design a garden and activity entirely different because their needs are different.
Right.
So again, it's the nature. It's the nature's generous and adaptive mechanism why it works.
So from the therapeutic area, is there something fundamentally different from growing things compared to just experiencing nature? Just kind of curious about that. You would think that there may be some difference.
I think it's a subjective difference. I know that people who are comfortable gardening and really like the experience of learning all there is to know about plants, that they like the hands-on experience.
Or kids with learning disabilities, for example. I would think, I don't know, this is just a association at this point, but them getting involved in gardening, which a lot of kids in cities don't have that opportunity, and seeing how things are created and grow may have some fundamental benefits.
Yes. I read an article about in a very, very well-written book called The Lost Child in the Woods. It's about the nature deficit syndrome, and that 39% of American children between the ages of 6 and 12 view nature as they're either apathetic or they're fearful about being in the wild.
Wow,
and so what does this mean for this generation of kids who maybe didn't have parents who took them out to look at the rain puddle at the end of the street to say, I wonder what's going on there. That was part of our formation.
Right.
And kids now are just really not having the same experiences and being introduced in a playful way, because it's all about play for kids, right?
For sure.
So if you're not making it a playful experience, there's no delight there. And so, of course, their brains are, as the great predictors, predicting it as an unsafe place. So, so with, kids with learning disabilities, it depends on what the learning disability is, what kind of activity I would prescribe for that particular group. And sometimes it's just getting a critical mass of clients with the same challenge to create the activity, because you're not going to put maybe in an intergenerational activity where you've got grandparents, who are on the spectrum with Alzheimer's disease, and you've got kids maybe with behavioral disorders, and you're doing an intergenerational event.
Yeah.
That would be
something
one type of
share.
activity. And that's a very powerful experience.
I love that. It's a beautiful idea, actually, way of connecting people. And that's actually a problem for a lot of people. We all want to engage our kids and our grandkids. It's sometimes difficult to know how to do that. So you can go out for dinner only a certain number of times. Obviously, eating is something we share, but working in a garden can be something that we share, or growing something is something we can share. So it's really powerful. I like that.
And it's also it's a really fun way to educate young people. I mean, to your point earlier, is that how many kids, when they're holding an orange, do they know that it was taken from a tree? When they're holding an eggplant, do they know it's a fruit from a vine? They don't know. And so you start creating these sense of connections for them at a young age, which helps them be critical thinkers, I think.
Yeah, interesting. So changing the subject a little bit.
Sure.
Yeah, I'm a research guy, as you know, and you and I had a little bit of a conversation about research. And you mentioned just earlier that the Japanese government or healthcare organizations that pay for healthcare will actually pay for some of these type of therapies. So talk to us a little bit about the evidence and the research that is a little bit more scientific and objective, since that's part of what we like to discuss here, is how we know that things actually work.
Well, unlike the medical or the dental profession, where there's, a compendium of different journals that one could read. There's one in therapeutic horticulture.
Okay, well, that's
the
at
American
least,
Journal of Therapeutic Horticulture.
at least it's one. Okay.
There is one.
Okay.
And so, again, these are articles, but they're not going to read in a scientific way. They're very, very subjective. So that's one of our challenges as a profession, is trying to legitimize our value because it is so difficult to test.
Right. But I think I read one of the articles that you provided, and there are observational studies.
Absolutely.
So maybe talk to us a little bit about the results of some of those observational studies.
Yeah, I mean, I mentioned earlier that about hospital design and the way hospitals are being designed now, that has nature in mind, and this whole biophilic response that I talked about, and that, you know, the healing times were more rapid and more complete in rooms that had a view to the outdoors. But, you know, there's articles about treating heart disease, kids on the behavioral spectrum. And how do we use these tests to actually improve their health over a long period of time? It's challenging, but they're out there. And you just have to dig deep to find them. And so when I'm...
Yeah, and I think there was some mention of the fact that there were some scales used to evaluate Alzheimer's patients that were exposed to horticultural therapy, and they saw some positive changes. Is that accurate?
I can say from my own experience, particularly our conversation earlier when we're doing olfactory experiences with Alzheimer's,
interesting,
because that's the oldest part of our brain.
Right.
And I've had nurses say, good luck with Mrs. Jones. She hasn't spoken in months.
Really?
And we would do a garden, and I was doing an activity. We were making satchels with dried herbs and dried flower petals for the ladies to put in their drawers. And I asked her, to breathe, to smell this particular herb, and she just kept on talking.
Really?
So and the nurses were, just gobsmacked.
Wow.
To see her talking.
Wow.
So there is something that it's mysterious in part, and when you see it, you can't unsee it. When you see how lovely it is.
That's so cool.
Yeah.
So this is now my clinical trial brain. I don't know if that's if that's prefrontal cortex or if this is the primitive part of my brain or somewhere in between. But something like this can actually lead to a randomized study where you have a dementia unit, and every other room gets a series of plants, and the other part of the other rooms would get something that's mechanical, for example, and see if you notice any difference in outcomes between these patients. And obviously, if you create a scale and then look at changes in certain functions, whether it's how much they speak or if they're able to solve simple questions or equations, and see how that progresses over time, it actually could lend itself to a randomized study. Now,
I'm immediately volunteering you for the journal here.
Well, I can definitely help you with the design.
Yeah, that's
fantastic. I can write it up, but I certainly can deal with all the logistics. And the truth is, it'd be hard to do a blinded study because your staff would obviously know. But from the patient perspective, it could be done in a way that gets an institutional IRB approval rather than a patient-level IRB approval. There shouldn't be any downside to having a plant in a patient's room that would cause any concerns for patient safety. And that would be a neat study.
That would be a very neat study.
Yeah.
That would be a very neat study, and one that I think is, easily rendered.
Well, hopefully somebody in a position to fund that study will be listening to our podcast.
That's the thing, is funding.
Yeah.
You're exactly right. Yeah. It is all about funding. So
and I can imagine that there may be some parties interested in it. There are obviously a lot of these things that get funded are based on self-interest. As a clinical researcher, I'm always impartial to the results. When I get paid for being a clinical trialist, it's because I'm just providing the data. I don't have any vested interest whether or not something works. but I would imagine there are people in the horticultural business that might be really interested in it. If a major scientific paper came out, or even a minor scientific paper came out, showing that certain plants in rooms can help behavioral issues in demented patients, that could be a home run, quite frankly.
Yes, and it's kind of a double-edged sword because, even in departments of integrative medicine, which are trying to expand, obviously, the protocols and the quality and types of care that are being available for their patients, is that they're looking for research. They want research, and so I'm challenged. I'm really challenged. So I can't wait to.
The discussion will continue.
Yes.
So finally, you have a fascinating story, and let's let our audience know how they can access your services. So tell us a little bit about your business and who to call and how to get you on a case and the kind of questions you can specifically answer.
Thank you. I'd be happy to. So I can be reached on my website, which is www.treysgardens.com, TREYSGARDENS.com. And so I have the ability to contact me for either horticultural therapy, forest therapy, guiding, or landscape design. And you can follow me also on social media at Trey Gardens.
Cool. And the type of clients you have will be listed there, whether it's intergenerational concept or a healthcare facility looking for creating an environment that's going to be more conducive to healing, or some specific area where people are looking for alternatives that aren't crazy expensive but can nonetheless be fruitful, pun intended, to their clients. You're the guy that we can talk to.
I am the guy that you can talk to, and I'd be delighted to. Thank you so much for having me.
Trey, this has been a wonderful conversation. Thank you so much. I've learned a tremendous amount, and you got my clinical trial brain working, and I'm there and available if we can figure out somebody that may want to fund this type of program where we can really learn in an evidence-based way how these concepts of horticultural therapy can actually make a big difference in people's lives.
Well, and I hope so, and I also for the planet. Because we're in a reciprocal dance with creation, and we have a planet in peril.
Yeah.
And the more sensitive and aware we are for the ways that nature is wanting to meet us and our needs, hopefully we respond in kind with gratitude by taking better care of her.
Absolutely, it's a great point. It's a different point, and we may have to bring you back for another podcast where we talk about not what we're doing for individuals and for wellness, but more from an environmental standpoint.
Absolutely.
Because I think they're actually different questions. And I always wonder about some of the concepts of using plant matter to help us with some of our environmental issues, and whether or not we need a better public policy measures in place to make a difference in that area. But in terms of helping individuals and humans, your information has been incredibly insightful. Thank you for being part of MedEvidence.
Thank you very much. It's been my pleasure.
Thanks for joining the MedEvidence podcast. To learn more, head over to MedEvidence.com or subscribe to our podcast on your favorite podcast platform.